What's your name?
Megan.
Nice to meet you.
Hello, konnichiwa. Nice to meet you. どうぞよろしく。
私のこれある。
私のそれある。
あ、でもこれあんま使わない。
使わない。
あんま使わない
なんかエピソード聞きたいみたいで、マレさん的には。そうそうそう。はい、先ほどマレさんから病院で働いて看護師として病院で働いていたけど辞めさせられちゃったっていう話を聞いたんですけど、詳しくそのお話をお伺いしてもいいですか？
Can you tell us about the story? じゃあまず自己紹介から。Okay. Could you say your name first and then and what you do now? And I want you to explain about the episode that you just told us about you got fired because of
Sure.
that. Yeah.
Yes, hello, nice to meet you. My name's Megan McNamara. I am now a filmmaker and a radio show producer and a host. That's happened because I used to be a nurse. I used to be a mental health nurse, and I worked for 13 years in Melbourne. I helped people with mental illnesses because when I was younger, I have a brother who suicided when he was 19. So I wanted to go and help. What's the point of complaining about something? You should go in and help fix things and do something about it. And so I worked as a mental health nurse. I loved my job and lived in Melbourne when COVID started unfolding. And I believed everything the health service said, the government, they told us that this was a deadly virus and we're all going to catch it and, huge chance of dying. In Melbourne, they had really severe rules. So I was following those rules, but some of the rules, they just became more and more absurd. You had to be wearing a mask out on the street, even if you're by yourself and there was nobody around. If you stopped to look in a window while you were out exercising for 1 hour a day, you were allowed. The police would pull over and tell you to keep moving, or you would maybe get a $1,600 fine, which is a lot of money in Australia. So things like that started to wake me up, and I as a nurse, was working all sorts of hours. We went into lockdown and I was allowed to go and work in the clinic. And I would work, people were really suffering. They'd lost all their support people and no one's allowed to visit anybody. And these are really mentally unwell patients who have lost their support people, can't have any contact with their family and friends. They're isolated. They've got very little money. So they don't have the luxuries that we have to be able to try and cope with those horrible lockdowns. And so work was very intense, and then we'd go in and out of lockdown in Melbourne. So there was always that fear, once we were out of lockdown, that if you did the wrong thing, you broke the rules, you would be someone who was going to spread COVID. And, so I was very afraid that I was going to be someone who would shut down our clinic. So we were all following the rules. And then I had my mother calling me from New Zealand saying, don't you take a vaccine, and, don't take this vaccine. It's, I don't know what's going on exactly, but there's something bigger to this. And I thought, oh, Mum, you've got some crazy ideas. She's got some really crazy conspiracy theories. I was like, there isn't even a vaccine. I'm not going to take it because there isn't anything. And then a few months later, there is a vaccine. And she says, don't take this vaccine. And I thought, well, this is a bit mad. They created this vaccine rapidly. How they couldn't have tested it with my health problems. So I have 3 blood clotting disorders, Leiden factor 5, protein deficiency S, and protein deficiency C. So this is really rare. And I had blood clot. So I've had a blood clot in my leg that went to my lung. That was after taking contraceptive pill when I was younger. Then I got another bunch of clots behind my knee when my brother suicided, and that stress is what triggered it. And, another 8 years later, I got another blood clot in my ankle. So I'm thinking, well, hang on, have they tested this vaccine with my illnesses? Do we know how it's going to affect my blood clotting? So in 2020, Melbourne went into lockdown and I was on a waiting list to have a brain procedure done because I had a blood clot. Not a blood clot, I had an aneurysm in my brain. So the blood vessel kind of pops open and it's a risk of bursting and it could kill me because I'm on blood thinning medication. So I'm thinking, well, hang on, have they tested this vaccine on how my blood vessels will work? How I had a whole lot of other health problems. And I just thought, my doctor had said to me, don't take the AstraZeneca. So that was the Australian vaccine. I say vaccine injection. Don't take the AstraZeneca one because that might make you clot. But if you want to take the risk, maybe you could try the Pfizer. And I was thinking, well, I don't want to take a risk. Thanks very much. That sounds like a really bizarre gamble. So when the opportunity came about after a year of lockdown, in and out of Melbourne's lockdown, I decided to apply for a quarantine spot to come home to New Zealand. I'm from New Zealand. My family is from New Zealand. But I'm also an Australian. So I just decided to get out of New Zealand. I managed to get a spot in the quarantine facility for April in 2021, and I came home and I was so grateful. But at that stage, I was someone who believed still that that COVID was going to be this mass extinction event, And so I was doing all the things that they were asking me to do in quarantine, put the towel underneath the door so that COVID doesn't come in and get you, because if you got COVID, you'd then have to go to further isolation, and I absolutely did not want to do that. And then when I got home to New Zealand, I started listening to Voices for Freedom. So that's an organisation that started at the end of 2020. 3 amazing mums who just didn't agree with what was going on and knew that it wasn't right to force people to have these vaccines. And in fact, some of them knew just how harmful these vaccines and other vaccines are. So they started this organisation, Voices for Freedom, and they were interviewing people like Dr. Peter McCullough and Bobby Kennedy Jr. and they've interviewed Del Bigtree as well. So they kept putting out information, and I'd be watching it in secret at my flat, so I wouldn't be caught watching anti-vax information. But it really helped me to see, okay, there's so much more to this, and I do not want to put this poison in my body. And so come to November 2021, after the government, led by Jacinda Ardern in Labour, she had said that they wouldn't mandate. But in November, on the 15th of November 2021, New Zealand government brought in mandates. So it was no jab, no job. If you didn't take that, if you hadn't had 2 shots by that date as a nurse, as I was working as a nurse, and I was working for the mental health service in the emergency team for children and teenagers. So these are kids who are really struggling anyway, plus you've got lockdowns, plus you've got masking. These guys are really, really struggling, and I'd just been trained up to be an emergency nurse, and 5 weeks later, I was sacked because I didn't take a vaccine. So I had a medical exemption written as well, but not government exemption. So in New Zealand, as well as Ardern, there was Chris Hipkins, at the time the COVID minister, and Dr. Ashley Bloomfield. So these people were making rules about how New Zealanders had to live, and they decided if you didn't take those 2 shots, you couldn't go into restaurants, bars, cafes, anything really. You could go to the supermarket, you could get on a bus, and you could go to the beach. So I spent a lot of that summer on the beach with my mum, and because of some protests that happened, led by the Freedom and Rights Coalition in New Zealand, I started going along to these protests and started realising, because I'd been wearing masks at this point, actually, even the mask is a lie. The virus can get in through gaps in your glasses, gaps in the mask. Like, it's just so ridiculous when you start looking into it. And so those protests led me to meet a whole lot of people who were outcasts from society, lost their jobs, fantastic people who were, doctors, nurses, paramedics, all sorts of people, and they'd been kicked out, not allowed to speak, not allowed to discuss what the issue might be. And so then in New Zealand, we were watching...
Let me cut first.
Sure. Am I doing too much information?
I know. She wanted to... Wait, the first... the people are coming out. That's why I wanted to stop for this.
Okay, sure.
Because the part we asked was the story of how you were fired. Because so you told
Great.
the story.
Okay, brilliant.
Yeah.
And so don't go into the book or...
で、だから何を言っても多分ね、英語で喋ると思うから、そのエピソードと、そのエピソードと、で最後のまとめっていうのが
なんか押しちゃった、ごめん。
これを最後言ってもらう。
押しちゃった。